So we are talking about obesity and weight loss as well. And we have a very special guest today. We have a medical doctor, right? Dr. Priti Parekh is going to join me in 1 second. And we will be talking about how functional medicine can help with obesity and weight loss, right? All of us are going through these yo-yo diets. So hang on for 1 second and when Dr. Priti joins me. Okay, so Dr. Preeti should be joining me. She is an American board certified functional medicine MD medical doctor. We are super excited to have you, Dr. Preeti. Welcome.
Thank you, Amita. I'm so excited to be here. Happy Friday.
Yes, absolutely. So Dr. Preeti is a medical doctor. She talks about her four wheels of health model. So before I go into all the details, um, Dr. Preeti, do you want to introduce yourself a little bit? Why you are so passionate about the obesity part of it?
Sure, Amita. We think of weight gain as most of us, we think of weight gain as aesthetic, right? From aesthetic point of view. But as a medical doctor, I've seen lots of chronic diseases also being associated to weight gain or obesity now. In fact, studies show that there are about 230 chronic issues which are associated with weight gain, not obesity, but also weight gain. So
Yes.
that's where my passion started, I guess, few years ago, and that's where I started looking into it. And can tell you how many times it's so satisfying, it's so gratifying. It's easy to it's a problem that's easy to fix, and it's so gratifying and satisfying to see people, finally get their health back, get their life back, and finally get those pair of jeans back.
No, I know. All of us go through a yo-yo diet, right? To lose those extra 5 to 10 pounds, but that's just normal. But like you said, obesity is such a pandemic in itself that there's so many chronic medical conditions that are associated with weight gain. But let's just talk about your mantra, right? What is it that your framework that you talk about?
So yeah, you raised a very good point, Amita, about the yo-yo dieting, which we also call cyclical dieting or cycling dieting, which is, as you paddle the bicycle, the paddles go up and down. So that's what yo-yo dieting is. We pick a diet and whatever the current trend is, and we lose weight. But then again, we're back to square one. So we lose, we gain, we lose, we gain. And studies show that, dieting, in the long run can actually increase your risk of obesity. My mantra is, it should be a lifestyle change. The change shouldn't be temporary. It should be sustainable. It should be something that you look forward to. It should be something you enjoy, not something that you implement, that you incorporate only for a brief period of time. So it should be a lifestyle change because, again, you're not only talking about losing those extra pounds, you're talking about gaining your life back.
Correct, correct. And I noticed on your YouTube, you have interviewed a lot of celebrities, specifically Bollywood celebrities. I think most of us now know about Bollywood, and Bollywood is literally Hollywood, but Bollywood in India. That's what people who don't know what Bollywood is. So, and these celebrities, they have so much pressure and stress to stay to look amazing all the time. So share some insights as to what is it that they do that they look so amazing and we have to work so hard here.
Yeah, Mita, I've interviewed quite a few that I've personally been, that I personally take inspiration from. And one thing I see in common amongst all of them, whether it's John Abraham, Sonali Bendre, Karan Johar, one thing in common is that they are all very, when they set a goal, they go for it. They are very motivated, dedicated, highly determined, good discipline and hardworking people. Now, they probably have, uh, uh, some more facilities than most of us. Like, they may have access to personal nutritionist, they may have a cook, they may have a personal trainer, but really it's, I personally feel like it's all these other qualities that matter more than anything else. John Abraham, for example, he said he's not touched a sweet, he's not had a sweet treat in 25 years. Can you believe that?
Oh my
Um,
God. Oh,
So yeah, and Sonali Bendre, for example, she struggled with advanced cancer,
Yeah.
but
Yeah.
she was determined she's gonna fight it. She was determined that she's gonna come out of it, and so she did. And so
Mm-hmm.
these qualities, they're just amazing qualities, and we can take inspiration from them, and set some goals for ourselves. I've interviewed, for example, Miss England from Miss
Mm-hmm.
England 2019. She's also a physician, Dr. Bhasha Mukherjee.
Oh, wow.
Uh, yeah, I've spoken to our, California Assemblywoman, Rebecca
Mm-hmm.
Kahan. And again, they, like I said, they, very motivated, strong women. When they set a goal, they just do it. They don't give any excuses. They just go for it.
Mm-hmm.
So whether it's health goals or life goals, we number one, we need to set goals, and
Yeah.
number two, we need to be disciplined enough to follow those goals.
Sure, sure. And I think setting the goals is sometimes hard. We all of us, we set the goals in the new year, and then all of us are going to the gym and doing all kind of things, and come February, March, and then boom, it just kind of drops down. It's like a, trough, and, it's kind of like that, right? For most of us here. So let's talk about a little bit about what are your thoughts on calorie counting, right? As a way to lose weight.
Right. Again, great point you raised, Amita. And especially these days, we see a lot of information out there that says, oh, calorie counting doesn't matter. It's you can eat how much ever you want. If you, especially certain diets, the way they advertise it, you can eat as much as you want. No need to count calories. But really, ultimately, it does come down to how much more calories, how much less calories you're putting in, and how much putting in less calories and burning more calories. The weight loss is ultimately, that's what it comes down to.
Mm-hmm.
Now, however, having said that, if there is a difference between calories of, let's say, you have a cookie which is 100 calorie cookie versus you have, let's say, sauteed vegetables which are also 100 calories.
Mm-hmm.
There's a difference because when you're eating vegetables, of course, it's more nutritive, more healthy.
Mm-hmm.
But apart from that, it has more fibers and some proteins, and the carbs that are in it are complex carbs compared to simple carbs that are in the cookie. So the glucose in it, the sugar in it, is absorbed slowly. The insulin spike doesn't happen as rapidly, and insulin, most of us know by now, it's a fat storing hormone. So again, what kind of calories you take in matters, but at the end of the day, it does matter how much calories you in. I hope that makes sense.
Sure, sure. And you talk a lot about your 4 wheels of health model. Can you explain us a little bit about what that entails?
Sure. So, the work I've done with people with chronic disease and people with obesity or people who've gained weight, I've seen that there are 4 things. If you take care of these 4 things, mostly, more often than not, you can, either halt the progression of your chronic disease. You can even reverse it to some extent. And so these mainly are the ones that I talk about. My 4 wheels are nutrition. So what you put in your body. Um, stress management, so how you rest your mind; sleep, so how you rest your body; and exercise, how you move your body. So these are 4 key components, and if you take care of all these 4, then you can like I said, reverse a lot of chronic issues. You can gain your health back. You can lose weight.
So how do we start? I mean, so what do you recommend to the viewers, like, someone who's a little bit overweight, and there's obviously chances of them getting chronic disease more than someone who's healthy, but how do you get started? Like, let's just go through a framework. Like, should we start with setting a goal first and then kind of see on a daily basis what we are eating? How do we get started?
Right. So, yes, Amita, setting a goal is very important. And I generally tell patients, do us, it should be, the setting should be SMART. So S is specific how much weight you want to lose. Okay.
Yeah.
And it should be measurable. Your goal should be measurable. So you should know that, okay, at the end of the week, I need to lose so much weight, and did I lose or not? And then A is attainable. Don't tell yourself I want to lose 10 pounds in. Okay, it should be attainable, and
Yes.
it should be realistic, and it should be time bound. T for time.
Yes.
So it should be time bound. So, have a timeline that this is the time frame I will lose so much weight in. And
Mhm.
ask yourself why you want to. Knowing your why is also very important. So why do you want to
Mhm.
lose weight? Write
Yes.
that down, and then it's important to do it with a professional,
Mhm.
somebody who can hold your hand and somebody who can guide you through that process. So, and then again, going through these four wheels, taking care of what you're eating, how you're moving. And it's not just the exercise that you do, the cardio exercise that you do, let's say 1 hour or half an hour a day. It's also, excuse me, it's also how you move throughout the day. That also is going to affect your metabolism. So,
Okay.
your movement, your stress, sleeping well. So, yeah, again, the time up with a professional is important, and just go for it.
Well, thank you. Thank you so much for sharing all these things. Anyone has a question? Your network connection, by the way, hasn't been very clear. So there has been a lot of intermittent kind of gaps when you were talking. So, but it's okay. I don't know what's happening. But to maybe let's just summarize what you're saying is that setting a goal, right, for all of us who are not as motivated as some of the Bollywood celebrity here, but setting a goal is important, and then following that goal, right? And you talked about the nutrition, you talked about the sleep, you talked about the exercise, and what was the fourth thing you said, Dr. Preeti?
Nutrition, sleep, exercise, and stress management.
Oh, stress management. Well, all of us are stressed nowadays. We all know that. So we just need to learn how to manage our stress. And sleep and stress all correlated to your point, right? And exercise and nutrition. So somehow we need to do these four